no other than Dr. Mario Ramirez, who would be lecturing about wound healing, 10 things you need to know. Okay, so before I would start, I would like to acknowledge also the presence of our president, Sir Leon Katz. I believe he's in the call, of course, and our other doctor, Dr. Arlie Imperio. Good evening, Sir Leon.
Good evening, good morning, depending on where you are. I'm very excited about this training. And we have, as you all know, or many of you know, there's some new people on tonight. We have incredible doctors and scientists working with us. So I'm here. I can't wait to hear the new research developed by Dr. Mario Ramirez. And again, it's a major blessing to have people like our good doctors working with us, because they have joined the mission to bring good health to people. What are the alternatives? How to do it? And it's not only for people who have stresses, it's for people who are athletes, people who are young, people who are old, young ones. It's really good for them. Everybody with DNA will benefit from our products. So I'm going to be quiet. I'm going to let the great doctor be introduced, and his credentials are tremendous, just like Dr. Arlie Imperio or Dr. O'Claret. So we're blessed with good people like that. So I'll be quiet. Francis?
Thank you very much, Sir Leon. Okay, next, Dr. Arlie, would you like to say hi to everyone? Dr. Arlie?
Yes, good evening, America. Good morning, Asia. We always look forward for this specialized discussion coming from our medical team. So have your notebooks ready and take notes and put in your questions in the chat box, and invite your friends by simply going to the list of participants, and then there's a small letter there at the left side, lower portion, invite, and then go to the chat messenger or email, and let them be a part of our lecture today. And I look forward to the lecture of Dr. Mario Ramirez, who is an orthopedic surgeon, and wound healing is an important part of that practice. Actually, everybody who undergoes surgery, there is what you call a clean wound. And I look forward to learn more details on how the, let's say, the body, 10 things that we need to know on how wound healing is enhanced. Francis?
Thank you very much, Dr. Arlie. Okay, so before I pass this to Dr. Mario, let me just read the profile of Dr. Mario. Dr. Mario is an orthopedic surgeon at the Philippine Orthopedic Center. He finished top of the class at the University of the Philippines. With us, he heads the dengue and dietary nucleotide study. He also heads the clinical study dietary nucleotides in children with neurodevelopmental disorders and autism. Now, he's a member of the International Society for Nutrigenomic and Nutrigenetics. He's also a member of the World Society of Anti-Aging Medicine. Okay. Now, together with our CEO, Dr. Susan Bardin and Dr. Arlie, they're all members of the Institute of Functional Medicine. Okay, so without further ado, let's all welcome Dr. Mario Ramirez.
Thank you, Francis. Good evening, everyone in the Americas, and good morning to all you guys here in Asia. I'm so happy in sharing this topic because one of the things you have to understand is that I'm a practicing orthopedic surgeon, and wound healing is the most important. Wound healing is very important for me and my patients, because before the advent of what we know today, my patients, after, for example, a surgery, would take weeks of being in the hospital. So I could not discharge the patient because either the patient is too weak or the wounds has not recovered fully. And what happens with my practice before is that a lot of my patients stay in the hospital for a minimum of 10 to 14 days on an average. And most of the money goes to paying the hospital. And what happens is that a lot of my patients could not pay my professional fee because by the time they get discharged, they are in a financial bind already because a lot of the expenses have gone to paying the hospital, and the poor Dr. Mario Ramirez does not have any money left to pay me. The doctors or the patient doesn't have any money to pay me. And what happens is that the poor Dr. Mario Ramirez is very sad. But now, things are getting better because there are a lot of things that has been in development and in science that has helped me in trying to reverse this problem of me not getting paid. And a lot of these things I will correlate with the surgeries that I've been doing. Okay, so the 10 things you need to know about wound healing. So before anything else, this presentation is only for educational purpose. There is no attempt to diagnose, treat, prevent, or cure. If one has any medical condition, it is apt for you to visit your doctor or physician, and the health statements provided herein are not evaluated, has not been evaluated by the Food and Drug Administration. So before anything else, let's watch this.
The largest organ in your body isn't your liver or your brain, it's your skin, with a surface area of about 20 square feet in adults. Though different areas of the skin have different characteristics, much of this surface performs similar functions, such as sweating, feeling heat and cold, and growing hair. But after a deep cut or wound, the newly healed skin will look different from the surrounding area and may not fully regain all its abilities for a while, or at all. To understand why this happens, we need to look at the structure of the human skin. The top layer, called the epidermis, consists mostly of hardened cells, called keratinocytes, and provides protection. Since its outer layer is constantly being shed and renewed, it's pretty easy to repair. But sometimes a wound penetrates into the dermis, which contains blood vessels and the various glands and nerve endings that enable the skin's many functions. And when that happens, it triggers the 4 overlapping stages of the regenerative process. The first stage, hemostasis, is the skin's response to 2 immediate threats: that you're now losing blood and that the physical barrier of the epidermis has been compromised. As the blood vessels tighten to minimize the bleeding in a process known as vasoconstriction, both threats are averted by forming a blood clot. A special protein known as fibrin forms crosslinks on the top of the skin, preventing blood from flowing out and bacteria or pathogens from getting in. After about 3 hours of this, the skin begins to turn red, signaling the next stage, inflammation. With bleeding under control and the barrier secured, the body sends special cells to fight any pathogens that may have gotten through. Among the most important of these are white blood cells, known as macrophages, which devour bacteria and damaged tissue through a process known as phagocytosis, in addition to producing growth factors to spur healing. And because these tiny soldiers need to travel through the blood to get to the wound site, the previously constricted blood vessels now expand in a process called vasodilation. About 2 to 3 days after the wound, the proliferative stage occurs, when fibroblast cells begin to enter the wound. In the process of collagen deposition, they produce a fibrous protein called collagen in the wound site, forming connective skin tissue to replace the fibrin from before. As epidermal cells divide to reform the outer layer of skin, the dermis contracts to close the wound. Finally, in the 4th stage of remodeling, the wound matures as the newly deposited collagen is rearranged and converted into specific types. Through this process, which can take over a year, the tensile strength of the new skin is improved, and blood vessels and other connections are strengthened. With time, the new tissue can reach from 50 to 80% of some of its original healthy function, depending on the severity of the initial wound and on the function itself. But because the skin does not fully recover, scarring continues to be a major clinical issue for doctors around the world. And even though researchers have made significant strides in understanding the healing process, many fundamental mysteries remain unresolved. For instance, do fibroblast cells arrive from the blood vessels or from skin tissue adjacent to the wound? And why do some other mammals, such as deer, heal their wounds much more efficiently and completely than humans? By finding the answers to these questions and others, we may one day be able to heal ourselves so well that scars will be just a memory.
So it's interesting because like anything else, wound healing is one of those things that we do not know a lot, and we underestimate the healing process. And like what Sir Leon has actually been trying to tell you guys, wound healing is a natural process. You do not go out, and if you get a wound or a wound in your arm, you do not have to say heal, 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 because that wound will heal naturally, unless, of course, there are outside forces that acts on it, like a glass, for example, a bullet fragment, a metal fragment, bacteria, which would prevent wound healing. All right. So let's go through the process of wound healing. There are 4 stages of wound healing. Number 1 is there's bleeding, there's blood clot formation. So whenever there is a penetration of a blood vessel, they try to minimize the bleeding by constriction by number 1, forming a blood clot with fibrin, wherein fibroblast and fibrinogen comes in, and the blood vessels constrict to minimize blood coming out of that penetrated blood vessel. The second process is called inflammation. And you see, and let me stress that inflammation is a natural process. It means that your wound is healing. If there is no inflammation, there's something wrong, as we can see later on. In aged population, the inflammation is depressed. So wound healing is depressed. So with inflammation, there is what we call a scab. When, for example, there's blood coming out, there's a scab plugging that that wound, that prevents the wound from continuously oozing and prevents bacteria from entering that wound. Wherein in inflammation, the white blood cells, particularly the macrophages, come in together with the fibroblasts that causes the proliferation for the next stage, which is called the fibroblast proliferative stage, wherein there is already proliferation and repair processes, and remodeling occurs as the last stage of the wound healing. So here's a good representation with analogy, because I like having an analogy to the house. So hemostasis, for example, which involves the platelets and functions to prevent bleeding, so it clots. It is very immediate. So when there's a wound, there is blood coming out, the platelets immediately go there. There's clotting and prevent blood from oozing. And this is analogous to the utility workers cup of broken, they repair broken utilities, like whatever there's that needs to be, like, for example, there needs to be some plastering on the walls or on the cement. They need to do that for the utility workers. The next stage is inflammation, which occurs 1 to 4 days. So the involved cells are the neutrophils and macrophages, and its function is to phagocytize or eat dead cells or bacteria, whatever foreign body there are in the wound. The only thing is that they cannot eat metal, glass fragments. They only can debar and remove cellular fragments. So the analogy is that they're like the unskilled workers cleaning up the site. If there is like construction being done, they have to remove the debris, and this removal of the debris is because of the neutrophils and macrophages. Okay, the next stage is the proliferative stage, wherein there is granulation and contraction. This occurs about 4 to 21 days. The cells involved are the macrophages, the lymphocytes, the angiocytes, which are the blood vessel cells, the neurocyte, which are your nerve cells, the fibroblasts, which produces fibrin, the keratinocytes, which produces keratin, that is the external layer of your skin. So the function or activity is that they fill the defects, they try to seal up the defects, reestablish skin function and closure. Contractors that analogous are these are the ones who start work are the framers, the plumbers, the electricians, the roofers, the siders, the cement people, and these are the ones responsible for trying to seal off proliferation, the seal of the skin. Then the remodeling, which occurs, which is the maturation stage, occurs about 21 to 2 years, and even sometimes longer for some people. And the remodeling, in which is like it's a scar revision of the scar. You can see this, that the scar may be initially too bad, but as time goes on, the fibrocytes remodels that scar, and there is scar revision, and the scar lightens up until you finally cannot. It's basically not noticeable after a few years, a couple of years. So what they do is they try to return the tensile strength of the wound. There are analogous to the interior finishings, the interior decorators of your house. So wound healing, there is inflammation, there is release of cytokines, there is expression of circulating lymphocytes, the histamines, the serotonin, the kinins, causes contraction of the blood vessel, decreased blood loss, and it acts as the chemotactic factors for the neutrophils to come over to remove the dead cells and infection, and it occurs about 24 hours initially. The proliferative phase occurs now, which is the remodeling, removal of the debris. The fibroblast migrates to the wound. There is angiogenesis, which is the formation of new blood vessels, which occurs about 48 hours from wound. From the trauma, there's secretion of collagen, wherein collagen is trying to make the surface of the skin more tensile, and the macrophages remodels and removes infection. Angiogenesis continues to about 3 weeks, which new blood formation. There is also an increase in wound strength, which occurs at the proliferative phase. Next is the maturation phase, which is the final phase, starts 3 weeks, continues to anywhere from 6 months to 12 months and even longer. All right. And this is where the collagen 3 is converted to collagen 1, and you get 80% tensile strength back, 80% of the normal tissue tensile strength. So wounds are not 100% normal. That is why sometimes we have to do a revision of the wounds, because we cannot go through, for example, you have a scar and you operate on the scar, you go directly through the scar. We do not do that. We remove the scar and make the wound fresh for new scar formation. So the factors that affects wound infection is that, particularly if you're getting infected, one of the things that we dread as an orthopedic surgeon is wound infection, because what happens if, for example, we put an implant, we had a new knee, a prosthetic knee in that patient. If we have an infection, we have to remove that prosthetic knee, which costs about 500,000 and throw it away forever. It cannot be used again. You cannot dip it in any sterilizing solution because the there are microscopic cells that could harbor the organisms, or opening microscopic vacuoles that could harbor organisms and cause reinfection if you use it again. So 500,000 peso implant will be thrown away. The wound needs to be cleaned and make sure with the antibiotics and given antibiotics before another implant is inserted. There are instances wherein one implant gets infected, we remove the implant, put the patient on antibiotics for 2 weeks, put back the implant, put another new implant, and what happens is that that implant becomes infected again, we removed again the implant, and the process is just a vicious cycle until finally the patient does not have a new knee or a new implant, because what happens is that they do not have money for new implants. And the patient-related factors that would encourage wound infection is that for patients who are greater than 60 years old, they are usually female, obese. They have remote infections elsewhere in the body. So the one standard thing that I do is before doing an implant surgery, because a total knee or a hip replacement or spine surgery, is that I have to have a dental clearance. Dental clearance because any infection in the teeth can seed that implant and cause infection in the new site, in the new surgical site. So underlying diseases like diabetes, congestive heart failure, liver disease, urinary tract infection, renal failure, all these can cause infection in patients, in surgical patients. Now, the duration of preoperative hospitalization is another problem, because if it's greater than 72 hours, and if the patient is in ICU, that makes the patient more prone to infections. That's why once I see a patient, I want to operate immediately, all right, before the patient changes his mind. And other problems like immunosuppression, because if the patient's under steroids or some immunosuppression medication, that would prevent natural healing and cause an increased possibility of infection. Okay, the other risk factors for surgical wound infection is the type of procedure. The more extensive, the bigger the incision site and the site of surgery, the more prone it is to infection. If you are putting any implant, metal implant, inside, that also increases the risk of infection. The duration of surgery, anything that is greater than 2 hours, could make the incidence or increase the incidence of infection. Other previous surgery, like for example, if they have had surgery, especially if that surgery is on the same site, it makes them prone to more infection. And often there are timing of antibiotic administration, and sometimes the type of antibiotics that are given can cause an increased possibility of infection. The placement of the foreign body, again, is imperative. You have to understand that you cannot use a used implant. Everything has to be new. Everything has to be sterilized. The incidents are higher in hip, knee replacement surgeries and heart valve and shunt insertion surgeries. So the cardiothoracic surgeons, as well as the orthopedic surgeons, are the ones that have the highest incidence of infection. Hypotension, hypoxemia, dehydration, hypothermia also increases the risk of surgical wound infection in the patient. So the second thing I want you to understand is there are two types of wound: the open wound and the closed wound. Open wounds are wounds of obviously they're open. They have exposed underlying tissues. They're open to the outside world. While closed wounds have damages that occur without exposing the underlying tissue, bone, or organ. You can just see that it's closed, but you know there's something wrong, or there's a fracture in the wound because the underlying tissue is not open, it's not open to the outside environment. Management for open is different from management for closed wounds. So some of the open wounds, for example, are the incision. There's clean surgical wounds that from a knife, for example, a razor, a glass splinter. There are laceration. This is the incision is a straight wound, while the laceration is a rough, irregular wound caused by ripping forces. Abrasion is like a bruise. All right, they're superficial. They're oftentimes just the top layer of the skin. Puncture wounds are caused by penetration of the skin, like a knife and a needle, for example. Penetrating wounds, which is another kind of puncture wounds caused by either a knife or a bullet. Avulsion is when part of the tissue, part of the skin is removed because of the wound is compromised, the tissue is compromised because of trauma. Like they usually occur in motorcycle accidents. I see a lot of avulsed wound in motorcycle accidents. Now, the types of closed wounds, or for example, are caused by damages damages to the tissue under the skin. So the skin is intact, but you know that there's a damages particularly caused by blunt object, blunt trauma, like a bump or a fall. Usually a closed wound would heal on its own for a few weeks. So if you, for example, have a closed fracture, it could be amenable to casting, because it usually just leave it alone and cast it or splint it. It will heal by itself. But once it's open, an open fracture, you need to do some surgical intervention. Either you debride it, clean the wound, then you put an external fixator to immobilize the wound. So contusions are bruise. A hematoma is a collection of blood. And there are some internal injuries that caused by crushing, like for example, the incidence of blunt abdominal trauma increases the internal trauma to the spleen. There is rupture of the spleen in blunt abdominal trauma. So the other thing that you have to understand is that there is such a thing as an acute wound and a chronic wound. So it depends on how long it takes to heal. An acute wound heals without complication. It's relatively simple. It has a predictable healing time, while chronic wound takes longer to heal and often involves more complications like infection. Chronic wounds occur in conditions wherein you have chronic problems like diabetes, bed sores, decubitus ulcers. These are the things that takes pressure sores that takes a lot of time to heal and more complications, very difficult for patients, particularly for my quadriplegic patients who are paralyzed from the neck down. Pressure sores are a high incidence and a high mortality because of sepsis. Infection cannot be controlled, and there is already extensive infection going through all the system, causing shutdown, multi-organ failure, and causing death because of sepsis. So acute is a recent, while chronic is a prolonged wound, usually about 3 to 4 months or more, while cuts and abrasion, acute trauma are easily managed and easily healed. Now, the other type of wound is that we have the clean and contaminated wound. Obviously, the clean wound are clean. That means there are no foreign materials, no debris inside. It is lower incidence of infection compared to a contaminated wound, which has a higher incidence of infection because there are dirt, bacteria, and other foreign materials inside it. Pressure wounds could be an example of an open or closed wound. Initially, a pressure wound like a decubitus ulcer is a closed wound. Then because of prolonged pressure, prolonged stasis, it becomes an open wound, and it becomes classified as an open, then becomes a chronic wound, then it becomes a contaminated wound. And by definition, an open chronic wound is a contaminated wound. So here's the surgical classification according to CDC. We have the clean, and usually are the operative incision. The clean, contaminated, they are not usually, an example is that a surgical wound that penetrates an organ like the abdominal cavity is a clean, contaminated. It's usually contaminated because of penetration of the gastrointestinal tract, like the small intestines or large intestines, because of a knife wound. Contaminated are open wound, are accidental wound, and there are usually higher incidence of suppuration or purulent discharge in this class 3 contaminated wound. Class 4 is an old traumatic wound. It's dirty, infected with the dead, devitalized tissue, which exists in the surrounding infection and could penetrate deep down into the visceral layer and cause more problems, especially if it involves the abdominal cavity. And you can see that fistulas occur wherein there is a passage of fecal material from the abdominal from inside your abdominal cavity, from, for example, your large or small intestines to outside to the skin, and it is a fistula can cause and become so infected it's difficult to manage and difficult to repair. So let me talk about the age. Okay. What happens when we age? Because age affects wound healing. Oops, sorry. As you age, everything slows down. Okay, all of the things slows down, particularly the repair process, the process of wound, the phases of wound healing slows down as we age. Skin becomes thinner. The repair mechanism for the skin slows down, and the body decreases the inflammatory response, meaning as you get older, the skin is predisposed to more injury and will heal slower, particularly when the injury occurs, especially if you have concomitant medical problems that can cause the wound to stop healing or that affects wound healing. Now, you see this slide, the effects of aging in wound healing, compared to the right, which is for us young individuals, Dr. Arlie and I, and you guys, the elderly. On the left, you can see that there is decreased epithelialization, meaning there is decreased formation of new skin, whereas for us young guys, there is easily increased epithelialization. There is decreased migration and proliferation of the new skin for the elderly. There is an increased inflammatory response. Inflammation is more severe in the elderly compared to an inflammatory response anywhere from 1 to 3 days, and after that it decreases. And what happens and finally is that the matrix, the fibronectin, the fibroblast, the fibrin, the collagen is decreased in the elderly, while the young ones, they're an increase in the matrix. So our skin is almost as good as new, 80% of the time. So now I want to talk to you about nutrition, because nutrition is vital for wound healing. Proper nutrition, again, with optimal wound healing is essential. A wound will not be able to heal properly if you lack the necessary nutrients for cellular repair and growth. Here, let me stress again, a wound will not heal properly if you lack the necessary nutrients for cellular repair and growth. All right, and we know from the discussions that we have had for the past few years, we know about the process of protein synthesis, and I will be talking more about that. The DNA, RNA, amino acids, protein. Okay, DNA, RNA, amino acids, protein. We need protein for cellular repair. Patients who who have an inadequate diet are at higher risk of infection. Malnutrition can cause a higher risk of infection and delayed wound healing. All right. So we will talk more about this one, and here are the nutritional requirements for, you have to have more protein, more amino acids to make new protein, so that you have to take a lot of the building blocks for proteins. What are the building blocks of the proteins? Nucleotides, amino acids, nucleotides, then amino acids. They form proteins, and the proteins will make up the bundles that would be essential for wound healing. Then you have to have energy. ATP, adenosine triphosphate, is needed because all these require calories. They need energy. Get that from again from nutrient energy high sources like proteins and nucleotides. Right? You have to have more fluids because water is essential. Vitamin A, C, zinc, copper, and iron are all essential. Iron particularly because red blood cells help transport oxygen, collagen, and nutrients to where the healing process is intended. So healing involves the nutrients, the carbohydrates, the fats, the omega-3 fatty acids, vitamins, particularly the fat-soluble vitamins, proteins and amino acids like the arginine, glutamine, methionine, and sustained minerals like copper, zinc, iron, magnesium, vitamin C, and as well as the functional food supplements like dietary nucleotides and amino acids and proteins. All these, more importantly, would contribute to wound healing, a successful wound healing. Let me talk briefly on obesity. You know, guys, there are a lot of problems, and one of the things I dread is operating on an obese patient. Number one, because it's so difficult to transfer an obese patient from the stretcher to the surgical operating table. Oh my God, sometimes it takes 4 to 5 people to transfer because the patient is already sedated. So transferring you have to have 5 helpers to just transfer the patient. Sometimes there was one incident that I had to use two surgical tables because the patient cannot fit in one. If you use just one, the patient will fall over. So anyone surpassing the ideal weight of 20% by 20%. So if you are more than 20% your ideal weight, then you are more or less considered as obese and have a greater risk of infection when you undergo surgery. other problems like vascular insufficiency, altered immune system, and obesity, lengthen the inflammatory process of wound healing. And again, if obese patients have a higher incidence of infection. Number one, because they have concomitant comorbidities like diabetes. They're usually diabetic, these obese patients. And when these obese patients undergo surgery, their wound heal very poorly to the point that they stay longer in the hospital. The other problem is that with repeated trauma, it affects healing. So multiple organs, or you have undergone severe trauma and surgery on one particular limb or site, then your defense mechanisms will be limited and slows. Your wound repair process will be slowing down because multiple surgeries on one site and multiple trauma, multiple sites of injuries can affect wound healing because you will need more repair process mechanisms, and you need more materials for the repair to undergo the wound healing to be done. All the more for massively multiple trauma injuries like vehicular accident, you need a lot of nutrients for the reparative process. Now, one of the things you have to also consider, for example, for me, is the skin condition. The skin needs an adequate amount of fluid and moisture to be viable. No, dry skin, which is common in the elderly, may be at risk for skin infections and lesions and thickening, and sometimes the thickening of the skin impairs the wound healing. On the other side of the coin is that if your skin is too wet, okay, it's too wet, you're at risk of developing macerations and infection. You can see this, for example, if you've been in the pool or you've been swimming for a few hours and you see the macerated, your fingers are starting to wrinkle. If you develop a cut, then continue swimming, that can cause more problems in terms of wound healing. So an adequate optimal level of skin moisture is imperative for wound healing. Now, lastly, let me talk about the chronic diseases. The chronic diseases have direct impact on the body's natural ability to heal, particularly cardiovascular conditions, which is the most detrimental and the most problematic in terms of wound healing. One of the things I do before undergoing a patient undergoes surgery, especially if they are 50 years old and above, they have to undergo cardiovascular or CP clearance, cardiovascular pulmonary clearance, from a heart cardiologist and pulmonologist, just to find out whether their heart and lungs can take the brunt of the surgery. Because if they have problems in the heart and the lungs, and the internist says that the patient has an immunocompromised immune system or has diabetes, then wound healing will become problematic and the patient will just stay in the hospital for a long period of time. And what will happen is that the patient will have no money to pay my professional fee. I don't like that. So when that happens, I refer them. If the patient has a lot of chronic condition, the cardiovascular condition, I refer the patient to one of my colleagues, especially the one I do not like the most. I send them that patient. And when they operate, they lose more money than they have and energy than they should. So another bonus fact is that there are some prescription medications that affect the healing process. For example, in our academy, the American Academy of Orthopedic Surgeons, they said they tell us do not use non-steroidal analgesics, because what will happen with, for example, ibuprofen, cataflam, painkillers, in other words, the non-steroidal NSAIDs, the non-steroidal analgesics can interfere with the inflammatory process stage of healing. So it prevents inflammation from happening. So there is less blood coming in. There is less white blood cells coming in because the inflammation is decreased. And what will happen, it makes it prone to infection. Other medications like anticoagulants, aspirin, Coumadin, that causes and disrupts blood clotting and causes bleeding. There are other immunosuppressants, especially if they're having problems with cancer, or taking steroids, for example, may weaken the immune system, enhances the risk of infection. So we usually ask them to stop their anticoagulants a few weeks before, their aspirin, for example, their steroids, for example, too. We stop them for about 2 weeks, then continue with the surgery. So let me cite some clinical studies on wound healing. And this is imperative because a lot of my surgeon friends, my friends from the orthopedic, as well as my general surgeon from the hospital, I cite these clinical studies, which is important because, for example, the healing in the ICU patients, early enteral feeding with the dietary nucleotides are safe, and enteral is not tube feeding. That means it's safe, well tolerated in ICU patients. What happens is that there is substantial reduction in the length of hospital stay. And more significantly, there is a reduced acquired infection. We call it a nosocomial infection, a hospital-acquired infection, which is about, it causes 70% of the hospital deaths. No? For example, the most common nosocomial infection, or the hospital-acquired infection, is a pseudomonas. Particularly if the patient is intubated, the patient is on a respirator, what will happen is that the pseudomonas will take over, massive infection will occur, and the patient dies because of sepsis. Now, skin tissue repair, topical applications of nucleotide, for example, improves cell energy and metabolism. Therefore, the health and appearance of the skin are better. It's actually better if you take it, and you can also use it topically. The dietary nucleotides affects tissue repair. And we know this because, again, from the one-page presentation, as we have again and again and again imparted to you, that the skin tissue repair is essential for wound healing. Dietary nucleotides affects skin tissue. This is from LE magazine, which is January 2003, written by, see the one in black, effects of from the LE magazine, the effects of dietary nucleotide on blood levels of prostacyclin and thromboxanes and winning rats. LE magazine, written by So again, let me talk about infection. Dietary nucleotide restrictions increases the mortality from staphylococcal sepsis. So patients, for example, this was taken and studied in patients, particularly in rats first. They appears that if you restrict dietary nucleotide, you are more susceptible to infections, especially the staphylococcus infection. Then the other dietary nucleotide studies, they said that, let me talk about wound healing and the benefits of clinically confirmed that there is a reduction in the infection rates. Dietary nucleotides reduces infection rates, reduces wound healing complication, and the average length of hospital admission fell, according to Senkal. Also, Braga and Daly said that the clinical studies from this group, there are shorter length of hospital stay, patients who are taking dietary nucleotides, lower sepsis score, and decrease in infection, complication rates, and length of hospital stay are reduced. So what happens is that this, for me, this is a blessing in disguise, because what happens is that for my surgical patients, usually they stay anywhere from 10 to 14 days before. Now I can discharge him in 3 days. A patient who gets in and out of the hospital faster, they pay faster. Again, let me stress that a patient who gets in and out of the hospital faster, recovers from the surgery faster, they pay me faster, and I get more money, and the patient does not have to stay in the hospital. They have more money to pay the doctor. Awesome! Awesome! Awesome. So the incidence of patients having no money to pay me had decreased to almost zero, especially for since the advent of me giving my patients dietary nucleotides Immurogen. This is a personal experience. I've been sharing this with a lot of my surgical colleagues, my surgery colleagues, and they're very happy, because one of the things that happens is that a lot of them have their patients in and out of the hospital faster, because not only is wound healing faster, but the ability of the patient to tolerate the surgery is faster. They are stronger, they have more energy, and they can get out of the hospital faster. So I want you to watch this just as something to help you, that the food is essential for wound healing. All right, so thank you, everyone. I'm open for questions. Thank you, everyone.
Well, Dr. Mario, I'm sure there's a lot to talk about after this. It was great presentation, because people in the past generally don't talk about wound healing. And wound healing, of course, is critical for all of us. And it happens many different ways, like wounds that do not heal right away, or diabetic wounds, and so many instances. And you brought the information to a level that we can understand. So I thank you for that. I'm sure if Dr. Arley is available, he might have some great comments to make relating to this. Dr. Arley, are you available?
Yes.
What a great
Dr. Mario,
training.
yes, Dr. Mario has given a comprehensive, detailed, but simple for everybody to understand. And remember that our skin is our first line of defense against anything that may harm. However, when the skin is broken, then factors that can affect the body can enter. And that's why the body will do its best to heal the broken skin, and that is wound healing. Now, in surgery, we have a clean wound where we first, of course, cut the skin and even go inside the tissue and even up to the organ level. And the real issue here is healing has to be done, has to be restored, but that's more easily said than done. And Dr. Mario, as an orthopedic surgeon, knows the importance of healing and recovery. The longer it takes, the more, let's say, possible complications can take. Now, Dr. Mario has showed to us the four stages of wound healing. The one that is involved in circulation, and then inflammation, and then the proliferative stage, and eventually the remodeling. And he gave a good tabulation with simple analogies for us to understand. And what I would like to take note is that the specific cells that are involved in each stage, for example, the platelets, the macrophages, the neutrophils, the fibrocytes, and so forth. Now, what I would like to point out is that all of these cells, especially the protein cells, are the proteins done by the central dogma of biology. Oh, yeah, this is the important slide, which I feel everybody should uh, take a picture and have printed, because you can scientifically share the four stages of wound healing. So there is hemostasis, and that is immediate. That is to stop, for example, the bleeding. And platelets are involved. That's the cell. And then inflammation within 4 days. The neutrophils and macrophages are involved. This is the innate immunity. And then the proliferation for the next, let's say, 2 to 3 weeks, it involves more cells like the macrophages, lymphocytes, angiocytes, neurocytes, fibroblasts, keratinocytes. And then eventually the remodeling or repair, where at least 80% of the skin is restored and the fibrocytes are involved. What I would like for everybody to understand, these cells are the cells that are created through the central dogma of biology. And we all know, we discussed it in the past with Dr. Mario, that in the central dogma of biology, the first step is DNA replication, to give the instructions to create the messenger RNA. And then the RNA goes out into the cytoplasm, and she needs the 20 amino acids to create the protein. That's why we call it the central dogma. And the good news is that we have the dietary ingredients in the form of food supplementation. And Imorigen is considered the best among them, where she has the ingredients, nucleotide, amino acids, and the peptides as a bonus. So everything is orchestrated by the DNA, and we call this homeostasis. And Leon has emphasized in the past well that when you have a wound healing, you don't have to command that the wound would heal. It would automatically be done, and that is through the action of the DNA. Therefore, it's very important that our DNA stability is maintained, our DNA repair is supported, our DNA health is, let's say, at par all the times, because it involves many things, and wound healing is one of them. And I would also like to emphasize that almost every day, thousands or hundreds of thousands worldwide of surgery is being done. And so if one will undergo surgery, it's very important that his immune system is strong. The skin integrity is also at its best. And all the factors that will lead to a rapid wound healing should be present. So this can be done before, or this element should be given before surgery, and it can be given after surgery. And Dr. Mario has cited studies that showed that there is less hospitalization stay. And one particular study where nucleotides are involved, which is given in parenteral nutrition. It's the formula Impact prepared by one pharmaceutical company, and it has nucleotides. So that's already one good, let's say, reference that Dr. Mari shared with us that we can share to the doctor. So that is one big, let's say, segment of population that we can serve. those who are about to undergo surgery or those who just had surgery. And Dr. Mario can directly see that as an orthopedic surgeon. He sees that every day. And his first concern is when surgery is done, that the wound healing is, and because of the feeling of a surgeon, if there is, let's say, complications like as we said, the skin protects us, and you broke the skin by having a clean wound. But if things goes in disarray, that can lead to infection, and eventually it can lead to sepsis, and it can also actually cause the death of the patient. Sepsis is a very dangerous complication. And then another important point is that the patient is in the hospital. There is what you call a nosocomial infection. His immune system should be strong, particularly the lungs, because one complication could be pneumonia. Oh, wow, there are a lot of things that has to be considered. So thank you, Dr. Mario. You did a well researched, comprehensive, but simplified presentation. Congratulations.
Thank you, Dr. Arlie. Thank you, Sir Leon. I just
Yeah.
want
If I may make a comment, and somewhere we can maybe address this. You know, if you, and in simple terms, if you support the body's structure function with the nutrients that it needs, like nucleotides, peptides, oligopeptides, the amino acids, and the minerals, then everything can get better, right? The body has an amazing ability to heal itself. Like what you pointed out earlier, you don't have to give an instruction to the body to heal a wound, right? It knows how to heal a wound. If it can, it will. So it just makes common sense that if you support the body, then you'll have a better result. And tonight we're just talking about an incredible subject, wound healing, but it has to do with everything, every part of you and our existence. And I just want to say thank you, because tonight we also have online, according to Joy, a local doctor, Dr. Apollonia Munoz. So I'm very pleased that this doctor is online tonight. And Jane Martos invited Jing, so that we have a lot of new people online tonight. And if later the good doctor wants to discuss something with you or has a question, I wonder if that would be okay.
Yep, that's going to be okay.
Okay, great. So carry on, Dr. Mario. Thank you again for that excellent presentation. Very nice.
Dr. Mario, this is Dennis.
Dennis,
Oops, I got a feedback from Maria's phone. I just want to tell you my experience with wound healing. Whenever I go for dental procedures, I always take the liquid before I go in, like 5 milliliter. And then as soon as I get out of the chair, I take another 5 milliliter and keep it in my mouth for a couple of minutes, all right, especially over the wounds. And by the next morning, I do that for the next day or two. But by the first day, the next morning, I don't need any more painkiller. And all I do is keep swishing the wounds in my mouth, the surgery that the doctor has done because of the, he put, I had 2 done, which was with, what do you call it, bone graft and sutures. And just by switching the stuff, I never needed any more painkiller, and it healed in probably 7 days, 10 days. It's 100% back to normal. I really love the fact of doing that whenever I do implants. Thank you for letting everybody else know about wound healing and how fast it heals whenever
Thank
you
you,
take
Dennis. That's
Immunogen before
great.
and after.
You know,
Thank you.
I remember not too long ago, we had a few dentists fly in to a meeting into the main office, and they flew in because they heard about the product and they wanted to understand it better and how they could use it in their practice, which they do every day. So, Dr. Mario?
Yes, corollary to what Dennis has said, there's a question by Mariette who said, can you use it for hypertrophic scars and hyperpigmentation and wound healing, particularly? I have used it, personally used Immurogen as a topical, for topical applications in the cubitus ulcer. As a matter of fact, a few months ago, I've shown it, the effect of topical application of the Immurogen on the cubitus ulcers as well as diabetic sores. And one of the things you have to find out, just for example, for you guys who have problems with stomatitis or oral sores, because for me, I'm particularly prone to stomatitis because, number one, I'm allergic to kisses. Okay, I cannot take two, I cannot have two or more kiss. No, whenever I have 3 kisses, what happens is that I burst out with the stomatitis. I have mouth sores, and when that happens, I just take 1/4 tablet of the Immune Plus, put it in my mouth as a candy, put it there, let it stay for a few minutes, and lo and behold, after a few hours, that stomatitis had basically healed, and there's less pain, no more pain, no more ulcer. In Tagalog, they call it singaw. Okay. And I don't know if you guys are familiar with oral sores or the stomatitis. It's an allergic problem, and I'm allergic to chocolates. Too much chocolates causes my mouth to burst out in stomatitis. Yes.
You were talking about chocolate kisses, huh?
Chocolate kiss, it's not a regular kiss, because that one, especially the regular kiss from France, are very good for me. The kiss from France, French kiss. So Kenneth says, what I do is that I cut the Immune Plus into 4, and that 1/4 I put it in my mouth, but let it stay in the part with the stomatitis in it, with the oral sore. And after that dissolves, that sore usually repairs, and I don't have any problems already. You can actually use that for any part of the skin, because I have had a lot of good results using topical application of the dietary nucleotides. Are there any other questions?
I had lunch with a doctor and a scientist today, and I was very honored that we met in Los Angeles. And she's treating all kinds of difficult cases, including COVID and other things. And anyway, when we explained the product, and this also biochemists, and when we explained everything, they were so excited. They were just absolutely excited about all of what they learned about the product. So we're surely on the right track, and I'm glad, and I hope everybody online, including the new doctors who are listening, study and learn more about it. So thank you so much, doctor.
All right.
I don't know if there are any other questions.
For other skin conditions, I really have not tried it because I'm an orthopedic surgeon. Okay. So maybe you can try it. I do not know the effect about using it with other skin problems, but generally, as an orthopedic surgeon, in terms of wound healing and infection, it works for me. And you have to understand is that the dietary nucleotides, just Google dietary nucleotides, clinical studies, or dietary nucleotides and immunity, and you'll see thousands of immune systems. I'm not saying this, that the scientists are saying that the clinical studies prove that the dietary nucleotides are essential for your immune system, for the repair of the gastrointestinal tract, for your gut health, for a lot of things, for your immune system, for your brain, so you just do your due diligence, and you will find that a lot of the things that I'm saying is actually backed by science. Dr. Arlie, Dr. Oclarit, and and me are not just the ones saying this. It is backed by medical science, by researches, by clinical studies, by doctors, by scientists, by a lot of people, not just us, no, because we're trying to give you the information. We're just trying to communicate the information from what we have learned, what we have researched, and trickle down that information to you guys. I hope we have learned something. I hope you also do your due diligence. And for questions regarding the other skin problems, honestly, I do not know. You try it, because I do not know. It's not going to become a problem. I'm pretty sure about it, because I have had open wounds wherein Immurogen is dropped directly to that open wounds. The cubitus ulcer wounds, I don't think I have it here in my laptop because it's in my phone. I cannot share it with you. That has actually improved after taking Immurogen.
Wow. Thank you for